What are ethics in modern psychology? Ethics are rules and principles that provide a framework for professional practice. In modern psychology, ethics help to protect the integrity and dignity of patients who use psychological services to improve their lives. The emphasis is on avoiding harm rather than mere compliance with rules. Ethical practice also protects psychologists and counselors as well as the individuals they serve. But this raises an important question. Where does the line between ethics and responsibility lie? Should all cases be treated the same? And how can we ensure that others are protected? In this three-part series, real psychological models will be used to examine different viewpoints and suggest approaches that may be beneficial for the world moving forward. What are the core ethics in psychology? The core ethical principles include beneficence, respect for autonomy, justice and fairness, as well as social responsibility. These principles are important because ethics help maintain trust. People need safe spaces where they can share their thoughts and intentions without fear of judgment. Historically, and even for some today, individuals relied on higher ranking members of their religious faiths and communities to share personal concerns, and this made them feel a sense of relief doing so. However, times and circumstances have changed, and many now seek a neutral professional to share very private information with, often due to a fear of judgment. Psychologists usually explain this as the need for neutrality and trust. In the part 2 of this series, this section will focus on how two important figures contributed to modern psychological practice, beginning with Sigmund Freud, who is often regarded as the father of modern psychology. Now, Freud's ethical approach placed strong emphasis on confidentiality and professional boundaries. He believed that behavior was strongly influenced by childhood experiences and unconscious processes. One of the benefits of this approach was that it encouraged individuals to reflect on their inner conflicts. Freud's methods influenced modern therapeutic practices by highlighting the importance of psychological insight and self reflection. However, Freud's model also raised significant ethical concerns. There was often a strong power imbalance between therapist and patients, with therapists holding considerable authority over the direction of treatment. This could lead to increased dependency, prolonged therapy, and an over sexualization of behavior. While Freud's approach helped link past experiences to present behavior, it also encouraged reliance on those past experiences, which is considered ethically problematic by modern standards. Adler's contribution to modern psychology. Now we go into Adler's contribution. Alfred Adler offered a different perspective through his model of individual psychology. Adler's ethical framework focused on personal and social responsibility, community, and a sense of belonging. Rather than concentrating heavily on past traumas or unconscious drives, Adler encouraged individuals to use past experiences to make positive decisions for the future. The benefits of Adler's approach included an emphasis on people and community, discouraging pathology of individuals, and placing a strong emphasis on the present rather than past mistakes. His model empowered individuals, encouraged self reliance, and promoted a collaborative relationship between client and therapist. Now, what were the limitations of his model? Despite the strengths, Adler's model also had limitations. One major limitation was the restricted data available during his time. It's evident that later research showed that individuals are often influenced by both environmental and biological factors, which Adler's approach sometimes overlooked. His emphasis on responsibility and social contribution could place significant pressure on individuals, potentially leading to negative effects. Additionally, Adler's studies did not adequately address severe mental illness, which may require prolonged care or mental intervention. In modern psychology, experienced practitioners work on a case by case basis, guided by ethical principles and legal frameworks. Maintaining a core ethical pillar such as responsibility, integrity, justice, and respect remains very essential. To conclude this series, one thing I must mention is psychology is a complex field, and while some practitioners may prefer one model over another, the well being of the individual should always be the top priority. Ensuring that individuals do not harm themselves or others is a fundamental ethical responsibility. This is where decision making becomes challenging for psychologists. If a patient shares very highly concerning information, professionals have to decide when it is appropriate to inform authorities. When such decisions may carry personal or professional risks in life or death situations, disclosure may be ethically necessary. Many real world cases have shown that individuals who have performed harmful acts were also affected by mental illness. This highlights the importance of balancing support with responsibility, emphasizing that as much as compassion is very important, accountability is also vital for developing a more ethical and effective approach to modern psychology as we move into the future. Thank you.